afternoon. PCOD, you have done a 360 degree of management time and again. I think every year there are at least 4 or 5 sessions on PCOD itself. Today we are going to talk on something very different. The first part will be focused on weight loss. Weight loss, whether you agree or not agree, that it is crux of the treatment. 50% of the management lies on weight reduction. This particular part is, if not realized by the gynecologist and if not understood by the patient, is a big failure. It means till the time you keep taking medicine, everything will be okay. The moment you stop the medicines, things are going to come back. So, I will talk. After that, Madam Srijan is going to talk. These people have developed this particular salt of Acumentis, which is called PCOS lite. She'll throw a light on it and she'll speak about it. And then we will talk about the practical aspect, concentrating first on the weight management and also getting practical tips of polycystic ovarian disease management. We are lucky today that in our discussion today we have a dermatologist who is going to enlighten you what is their policy about it. And we also have 2 nutritionists and dietitians who are PhD by themselves and who have been really incorporated in the management policy. So I think you all have to get sensitized to this particular aspect, that if you want to give 360 degree care as far as the PCOD is concerned, you have to become sensitive to the weight loss. We all know that in PCOD there is increased hypoandrogenism which is at the core of it. There is insulin resistance, which is again biggest factor, which is at the core of polycystic ovarian disease. And we find that there is a problem of infrequent ovulation or anovulation, and which give rise to irregular periods. There is an oxidative stress which is again being talked in majorly as far as the trigger factor for the polycystic ovarian disease is concerned. And we find that quite a good number of patients who do not have hypoandrogenism, who do not have features of insulin resistance, and still they have weight, which is plus, whether they are overweight or they are obese. We also know that there is increased hypoandrogenemia, there is anovulation and oligoanovulation. There is typical picture on the ultrasound picture, and weight is also one of the significant presentation. Now, as far as the obesity and PCOS is concerned, the incidence, we all know that as for the PCOD is concerned, in the Western world around 6 to 10%. As far as we are concerned, it is little more, because we being the capital of diabetes, insulin resistance and whole lot of medical syndrome disorders, we find the incidence with us is around 10% in the general population, infertility around 25 to 30%, and the same is the incidence in adolescent. There was survey done by the Indian Academy of Pediatrics, and they even said that it is the incidence varies something like 30 to 35%. So we will have our experts, let's see what they say about this. Obesity may contribute to subinfertility. We all know about it, that it is mainly because of the hypoandrogens, hyperinsulinemia, chronic inflammation, insulin resistance, interplay between hypothalamic pituitary ovarian axis dysfunction, which is cause defective follicle development, oocyte quality, and endometrial receptivity is marginalized. It is also responsible for bad reproductive outcome. 50% of recurrent cases, missed abortion cases, are also because of the polycystic ovarian disease. So the incidence of obesity varies from 40% to almost 90%, with an average of 50 to 60%. Obesity and insulin resistance are two sides of the same coin, and the defect is worsened whenever a patient has obesity. Glucose intolerance and obesity in PCOS, we all know that there is a higher rate of glucose intolerance whenever there is obesity, and obesity does worsen glucose intolerance. The question comes, as we used to learn it in undergraduate, can obesity cause PCOS? Yes, because it increases insulin resistance, it causes chronic inflammation, and hence it leads to polycystic ovarian disease. And secondly is, the woman always gets scared to get on the weighing machine, because every time the weight is up, it doesn't go down. Does PCOS cause obesity? The PCOS increases insulin resistance. High levels are the ones which also indirectly cause hyperandrogenemia. High androgen levels lead to weight gain and other symptoms related to hyperandrogenemias, excessive hair growth on the body, acne, and irregular periods. As far as our ovulation is concerned and the womb health is concerned, we all know if everything is all right, the hormonal levels are okay, then it definitely sees to it that follicular phase of development of follicle takes place and there is an ovulation. But in polycystic ovarian disease, you find that there is a recruitment, but there is an arrest of the follicle development. And that is why you find there is a multiple follicles creep around, make a necklace pattern in the ovary, and which is very classical of polycystic ovarian disease. As for the oxidative stress is concerned, we can see that oxidative stress is at the core, and this not only causes insulin resistance, it also causes hyperandrogenemia, it causes central obesity, whole lot of changes which occur as a result of an ovulation. Ovulation is seen here, and then you feel that it has a bad effect on the reproductive outcome, which is all related to oxidative stress. In oxidative stress, how it is produced, we all know that to produce energy in any cell, you require a cycle, and during this particular cycle, certain amount of antioxidants, certain amount of reactive oxygen species are born. In a small level, they are very good, but when they pile up in the system, they spoil the whole show. So RRS free radicals are seen plus amount in PCOD. It can lead to cell damage. ROS alters steroidogenesis in the ovary, and it also causes increased androgen production, disturbed follicular development, and infertility. You can see here that the various antioxidants which are available now in our diet and endogenously are with us are vitamin C, vitamin E, selenium, and zinc. Now what happens whenever there is a healthy atom and you find there is surplus of free radicals in the body? The free radicals takes one electron from us, and once it takes the electron from a healthy cell, all metabolism changes starts taking place. And what antioxidant does? It gives the same electron to this reactant oxygen species, and then thereafter this particular reactive oxygen species becomes ineffective. It becomes ineffective to the tune that it's almost like a water. I am not going to dwell on it because many times we have talked about what antioxidant does in our system. But today our main emphasis is on the weight. Now there are so many guidelines. Whenever there are multiple guidelines, we know that the people who are experts are not clear, and that's why one guideline, thereafter many other guidelines follow up. So it speaks our mind that we people are not knowing everything about polycystic ovarian disease. I will see that you should make a note of PCOS. I am going to talk about it later. Now people used to have individually guidelines, and now the consensus is building up that अकेली बात करने से कोई फायदा नहीं, साथ बैठ जाओ और एक consensus guidelines we should bring over. So the international evidence-based guidelines for the assessment and the management of polycystic ovarian disease 2023 says, in women with PCOS, a lifestyle intervention effective for improving anthropometric, metabolic, reproductive, fertility issues, quality of life and emotional well-being outcome as far as the PCOD is concerned. Insulin resistance affects 75% of the lean PCOS and 95% of the ladies with a BMI of more than 25 with PCOS and is further exacerbated by excessive weight. In women with PCOS and excess weight, lifestyle interventions which reduce total body weight by as little as 5%. We used to talk about 10%, but now it is said that if you reduce by 5%, everything is going to be effective, have shown metabolic, reproductive and psychological benefits. Nobody has boldly said that the 50% treatment of obese PCOS is weight loss. And whenever we find this particular part is ignored by the gynecologist or patient herself, then we find that she is, as such, there is no cure. But in this setting, to treat that particular patient becomes very difficult. Now, lifestyle behavioral interventions are first line of weight management. However, come here, come this side, you will be able to see it better. Come. However, you find that the evidence for the impact on the fertility outcome in PCOS is limited. We are talking on issue weight loss and weight loss. But as far as the clinical evidence is concerned, or the evidence by the research is concerned, their impact on the fertility outcome in PCOS is limited. Macronutrient dietary composition in women with PCOS in weight loss is very crucial. Whenever we give very low energy diet, it means we are curtailing 1/3 of the total calories which we give. अगर मैं 1500 लेती हूँ तो मेरा 500 हटाएंगे, 1000 करेंगे. In that particular case, it definitely brings about significant weight loss by to the tune of 10 to 15% in 12 weeks time, and which is said to be effective. Very small few studies have been done on this scientifically, and you find that they have been encouraging. As far as this lifestyle behavioral intervention is concerned, it improves ovulation and pregnancy rates, but the evidence is weak in relation to live birth. Pregnancy happens, but as far as live birth is concerned, again, it has not reached the final stage. Now, whenever we do a markedly restricted diet in calories, it achieves a greater weight loss, can improve fertility and pregnancy outcomes in women with obesity, although these trials were not PCOS specific, and then the dropout was high. You can see this particular slide, and there are various groups of BMI are there, and for we Indians and Asians, minus 2.5 with every category. So if you find that a BMI of 25 was there for a normal as far as the Western world is concerned, for us it is 23. In similar way, when we say it is obese, for them it is 30, for us it is 27. And you can see here, whenever you find that the people who are normal weight, here also it has been said that the people who are lean PCOS, उनमें weight gain नहीं होना चाहिए. जो overweight है और obese है, उनमें weight loss mandatory है. So there are two people. One is lean, उनमें weight gain नहीं होना चाहिए, और जो obese and overweight people हैं, उसमें आपको weight loss is mandatory. So initially you can find that when you are maintaining a normal weight and a normal BMI, your dietary interventions are good enough. But agar you come into overweight category, diet alone is not enough, and you have to combine with the exercise, and you have to see to it that your behavioral changes are also there. I commit myself that I'm going to do it. Self goals have to be set. You know, you put down on in the rooms that mujhe walking ke liye jana, mujhe ye karna, mujhe ye karna. So that kind of behavioral workout is also very much required with this category. Then comes various kind of anti-obesity medications, which a variety of anti-obesity medications have come in the market, but most of the time they have been causing suicidal tendencies. So you find they come with a big bang, but they are withdrawn. We find that we are not in habit of using this anti-obesity medications, but we are definitely come to hear today that what is this PCOS lite as far as Acumentis special diet supplement is concerned. And we all know about the bariatric surgery. There are definite indications for bariatric surgery. The people who have had a bariatric surgery, they have definitely find, you know, the results are absolutely encouraging, but that's a category by itself. As for the lifestyle modifications are concerned, I repeat again, whether it is you or me or patient of PCOS with the normal weight, healthy diet, regular physical activity and behavioral strategies are must for these people, irrespective of their BMI. People who are overweight and obese people, they definitely have to find the loss of 5 to 10% weight, and then these people have to have a specific understanding that they must maintain this particular weight. Now, as for the diet and the reduced calories are concerned, diet with reduced calories promotes effective and sustainable weight loss, irrespective of the macronutrient composition in general overweight and obese population. कहने का मतलब है weight loss होना चाहिए, किस टेक्निक से होता है, it doesn't matter. Diet with reduced caloric intake is also effective in overweight and obese women with PCOS for weight loss and improvement of insulin resistance and hyperandrogenemia. A daily deficit of 500 to 1000 kcal recommended for promoting weekly weight loss of 0.5 to 1 kg, which approximately accounts for 15 to 30% decreased calories from your habitual intake in the general overweight and obese population. Now, as far as the BMR is concerned, BMR is once, you know, where we normally doing our daily course, we require a certain amount of energy. So you find our BMR of PCOS patient is also low. That's why आप चाहते हो कि adipose tissue से वो calories आए और burn हो adipose tissue, वो हो नहीं पाता because the BMR basically of these people is less. And these findings could partly explain the difficulty encountered in a woman with PCOS trying to lose weight. The diet recommendations are similar to general population, and energy deficit of 30% or 500 to 750 kcal per day, depending upon the individual energy requirement, body weight and physical activity status is recommended for obese and overweight women with PCOS. Dietary intake and the quality and the content of the diet might interfere with the metabolic and endocrine abnormalities of PCOS and could partly be involved in pathogenesis of the syndrome by affecting insulin resistance, by hyperinsulinemia, and by hypoandrogenism and by weight gain. The low fiber, high lipid diet was proposed to be associated with increased estrogen and androgen levels as well as decreased SHBG levels favoring development of obesity. We have come a long way from there. The individual studies proposed differently results with a different macronutrients including monosaturated fat enriched diet, low glycemic index diet, low carbohydrate and a low glycemic index diet and a high protein diet. So you find that when it comes to diet, weight loss, we find it is mainly the caloric restrictions, and the personalized approach is used by dietitian and nutritionists for you, and they take care of the healthy food consumption when they plan a diet for yourself. As for the physical activity and exercise is concerned, I am not going to dwell into it. There are 3-4 slides about it. Roughly it comes out to be that PCOS patients who are obese or overweight require a double amount of calories expenditure in exercise. Roughly it is said to be 9 hours, and 9 hours of exercise is emphasized. Normally it is said for each one of us, it is 150 minutes of moderate exercise and 1 day of the vigorous exercise of 75 minutes or maybe an hour or so. So for PCOS at least those Zumba classes to hoengi, which makes vigorous exercises, and then over and above 30 minutes daily, or for us it is 30 minutes daily, for PCOS patient it is 1 hour daily. Behavioral and a cognitive therapy is very much required in case if we have to see to it that not only obese but associated medical conditions like diabetes and cardiovascular diseases need to be addressed or their prevention is planned. And these behavioral changes are cognitive approach, improving the ability of the self-monitoring, decreasing quantity of consumed food products, and psychological skills, and induce how to go through all this big trial. We find that whenever one is serious about things, and various few studies have been done where it has been found that over a period of 3 to 4 months they can lose up to 11 kg of weight, and this amounts to BMI loss of 3 to 4%. I can definitely say whenever you have a weight loss, there are tremendous benefits for it. Not only you reduce the weight, you have an extra energy, your immunity is increased, your sleep is great, and the risk of various metabolic disorders markedly are curtailed, and you develop a great self-confidence in yourself. There are various myths are there among us that the crash diet does wonders. It does the opposite. Skipping meals is very common among all of us, that we skip meals, but in the end we end up taking more calories. We feel that all carbs are bad, but we feel that what is that called? Carbohydrate? Complex carbohydrate are very much required, and it should be part of a diet. And I feel the crux is 50% of your diet should be vegetables and fruits, lean proteins, and many people have an idea that vegetarians do not have a good stock of proteins, but I can definitely say that soya chunks, 50%, 50 grams per 100 grams is there. If you take bhuna hua chana, chickpeas, again 19 to 20%, and this paneer, tofu, all these things are great, and I think you don't have to really get worried about it as far as this part is concerned. The healthy fat, which Dr. Deepika is very fond of to tell each one of us, healthy fats are nuts and seeds. Nuts and seeds, and seeds, and water. Jainism tells you that not only water is important, if you take a lukewarm water, it will help you in further weight loss. So in summary, the PCOS is a most common hormonal abnormality in reproductive age, which can lead to obesity and increased weight in a female, and the weight management and exercise is considered as a holistic approach for reducing weight in PCOS patients. So with that particular thing, now I invite the nutritionist and dietitian who has developed PCO Lite for Acumentis. She's done a lot of work. Srijan, come. Come here.